Hi everyone, I'm Georgiy Brusavalik, orthopedic spine surgeon, and I'm here with Dr. Jose Mena, interventional pain specialist, to talk about back pain. Welcome, Dr. Mena.
Hi, how are you, man?
Great to see you. So, as we were talking, when it comes to arthritis and patients being at home, when it comes to patients losing their usual level of activity, what are the symptoms that you're seeing?
We're seeing a lot of this type of patients that they were previously fine. They were not having any symptoms at all, barely any back pain before, and all of a sudden they start having back pain. So they are more sedentary. They're living more of a sedentary life right now because of the gyms. They're not working out. So they're not keeping up with their shape. So those patients all of a sudden decide to become more what we call a weekend warrior and do some activities, start running all of a sudden, and they're starting to injure themselves. So that's one of the things that we're seeing a lot in the clinics right now.
I frequently have this conversation with my patients. Doc, how am I supposed to exercise when I have so much back pain? What can I say to these patients?
So that's actually an excellent question. So normally on those type of patients, we ask them, at least we show them at least some exercise program. There's two ways of doing it. Either I show them or we give them a brochure of some exercises for them to do, or we send them to a specific type of therapist, physical therapist that are trained in manual medicine. So they should be able to guide them through their rehabilitation and guide them and eventually restore their functionality and their activity level. So getting back to the point that they were pre-injury. So that's why either way is fine as far you're progressing, you're getting better. Most of the patients, and I would say over 80-90% of the patients, they were gonna do fine. The key there is the consistency of once you're done those exercises to keep doing them. It's not that you had the back episode, you got cured, and now I don't need to do those exercises. On the contrary, you want to keep doing those exercises regardless if you have pain or you don't have any pain at all.
Sure. But how do you explain these sudden onset of aches and pains? How do you explain that situation where, oh, I was doing nothing, I was lifting a cat, and suddenly it's this horrible pain and I can't move?
So that tells me one thing. Most likely the type of injury that they're developing, like all of a sudden, that will make me think that most likely they injured themselves in the disc, internal structures within the disc. And in order to injure your disc, that tells me that the structure, the muscle that they're surrounding the spine are weak. So that means that there's already a pre-existing deconditioning program, or awkwardly you lift it in an improper fashion and you injure yourself. So gladly that most of this type of injuries they get better, but once you have this type of injury, we know that from studies there's a 50% chance that those injuries can reoccur within 1 year.
Do you think that there's a genetic component to back pain?
There's that's what has literature my support, that there might be a familiar or a genetic component, but the, also the converse is not true, because there's some people that they don't have any family history of back problems, and all of a sudden you are developing back problems. So that tells me that there's something going on either mechanically, or your muscles are not strong enough and you're putting yourself at risk, or the type of lifestyle that you're doing, you're lifting too heavy at work, or you sit for too long. Also those things they contribute. And of course, because your mom, your dad, your grandpa, they never had back problems, that doesn't put you on exempt that you're not going to have any back pain at all.
Let me ask you something that's, I think, important for patients to hear. The great mimickers of the simple back pain. What can we tell our patients to look out for that will tell them that this is not just back pain, but this is something that they should, brave the outdoors and have looked at?
Yeah, there are a couple of mimickers that actually, one of them, the one that comes into my mind, thinking that recently at AAA, abdominal aorta aneurysm, like there's a break of that can cause you back pain. So, and actually that's a very life-threatening condition. Some other less likely are like people that they have hip arthritis and they're referring pain in the buttock area. And when you're examining them, it's not their back, and something that might refer pain down the legs. And it's not your back, it's your hip. See how you're walking with a limp. So those are things that we typically tend to look out. Other GYN structures, like having big fibroids, that can cause them a referral into the SI or sacroiliac joint, into that region. And it's not that you're having musculoskeletal type of pain. It's actually more what we call visceral pain or organ-related pain, and it's presenting as having back conditions. Some other conditions like fibromyalgia, generalized body pain, that yes, your back pain or your neck pain is part of your condition, but it's not treating your back pain or your neck pain. You have to be seen by a specialist like a rheumatologist in order to treat you overall, and that actually will make most likely your symptoms better.
That was a great list. I think that probably includes the vast majority of causes of lower back pain. I would just add that if the pain is a bit higher in mid-back, one of the scary ones would be a kidney problem, like a kidney stone. And I know that
Correct.
the pain from that can be real severe as well.
As well, and another one that we get actually is vascular. Like if you have
Right.
claudication or your arteries are tight, you might present like having people call sciatica or what we call neurogenic claudication. And actually, it's not that. Actually, it's your vascular, and that's something that will warrant more attention rather than a simple spinal stenosis type of symptoms.
Right. Now, Dr. Mena, earlier you mentioned doing some exercises at home and abdominal strengthening. What do you think is the best way for patients to start with abdominal strengthening if they have never really considered that?
That's a good question, because the thing is that how we see it, and traditionally when we look into this type of structures, actually depending on what's causing you the problem, it's your disc or it's a posterior element like the facet joints or spinal stenosis, the exercises that they might be done differently. But a good way to start will be more in a neutral fashion, so that way you're not putting yourself in flexion or extension, bending or extending your back, and that you can start helping yourself out in a more neutral fashion, and then depending on what directional preference you have, that might be able to help you get better.
Dr. Mena, thank you so much for answering my questions, difficult questions,
Thank you.
and thank you to the audience for listening to us talk about back pain.
Thank you. My pleasure.